or just a minute actually. There's a few more people joining I can see, so we'll wait another 30 to 45 seconds before we begin. All right, it looks like we've stabled. It looks like the registration people coming on board has somewhat stabilized, so I'm going to go ahead and get us started. As I mentioned before, this is Lynn Holheide with the Center on Great Teachers and Leaders, and I welcome you to this webinar this afternoon. I am joined by good colleagues and friends of mine, both Rory Fitzpatrick and Kristen Reedy, who are the co-directors for the National Center on Systemic Improvement. So we welcome you to today and are very glad that you are participants. Before we get started to the nitty-gritty of why we're together today, I wanted to just review a couple of logistics relative to the webinar platform. First, this is a go-to webinar platform, which is new to us here at the GTL Center, so we will ask maybe for some patience as we move along in doing this webinar platform. But wanted to kind of give you an idea. There is a chat box very similar to all webinar platforms that you can chat into. If you wouldn't mind, as we're getting started, just chatting in the chat box who you are and your organization in joining. That would be very helpful for us as presenters, and that will also get us an opportunity to kind of test out this platform of ours. So if you would, go ahead and begin typing in. At the present moment, you all are muted. However, we want to make this webinar, because it is fairly low in numbers, pretty informal. So if you want to chime in or ask a question at any point in time, feel free to raise your hand or unmute or put into the chat box that you want to contribute, so that way us as presenters can stop and give you that opportunity. We do really want this to be somewhat informal, although it's very hard sometimes in a webinar platform to be able to do that. Again, I'm joined by Rory Fitzpatrick and Kristen Reedy, and this webinar, just for those of you who are on the line, and right now I can't quite tell, I'm waiting to see some chatter on who's all here. I did see the registration list. This webinar, as you can see on the screen here, is really for Regional Comprehensive Center staff, and it is designed to just increase awareness and opportunity for collaboration among the regional comprehensive centers, as well as the national centers, being the GTL Center as well as NCSI. I do think we might have other representatives on this webinar as well, and you're most welcome to continue to attend. I know that there's some regional center staff that are with us, as well as some staff from NCSI. All are welcome, and there could be some other folks that are present as well that want to learn a little bit about the efforts relative to NCSI, and you're most welcome to stay on and join as well. But I just wanted to call that to your attention in case it feels like this webinar is more geared towards the regional center staff, and that is because it is. We're going to go ahead and get started with a polling question. And if Whitney, if you could pull that up for us and just kind of get a feel for what, out of your crazy schedules and your busyness, what made you decide to participate in this webinar. So Whitney, if you could get that poll going, that'd be great. And for those of you who are on the phone and participating in the webinar, all you need to do is select one of those reasons, or all that apply, and then you'll hit submit at the bottom of the screen. And as you guys are doing that, I'm going to do is just do a double check with you, Whitney. I don't see any chatter in the chat box. Is that because I don't have it set right, or we don't have anybody putting anything in there yet?
It's not coming through the chat. It's coming through a question pane, and I think I'm the only one with access to see it.
Okay. Interesting. All righty. So if you wouldn't mind, if you could take that and copy that when you get a second after the polling and just plug it into the chat box, that would be very helpful if you could do that. Okay. And I think we can probably, if you feel like we can go ahead and close out that poll, that would be helpful. All right, before we get on to the webinar, let's see who's here. It looks like many of you want to learn about NCSI. Good, we will accomplish that. And then also think of ways that we can think about collaborating. And many of you indicate that your state, not surprisingly, has some interest in helping improve the outcomes for students with disabilities. All good reasons to be here. The last one we'll talk a little bit more about, which I'm sure many of you aren't quite as familiar with, is the State Systemic Improvement Plan, which we'll share with you here in a few minutes and can give you an idea there as well. Great. Whitney, if you could close that down and put us back to the PowerPoint, that would be great. All right, if you look at the next slide, hopefully you can, as we just mentioned, these are the reasons that we wanted to have this webinar. It was really to make connections and foster collaboration and coordination opportunities between the regional centers, GTL, and the National Center for Systemic Improvement to create opportunities for alignment and for you all to get a feeling for what NCSI is about, what kind of supports are available, as well as ways to connect. We can go ahead and go to the next slide. So I wanted to just call out to all of you our charge and our commonalities across the board. I know many of you in the role that I serve as the Deputy Director in the Center on Great Teachers and Leaders and in our collaborative efforts in the Regional Comprehensive Center work and supporting states. And as you see, there's a little Superman at the top, but we're all basically here, everybody who's on the phone, really designed to support states in providing technical assistance to build capacity. That's why you see that little muscle man across the top. And I'm going to stop there for just a moment because I think somebody might have on their phone, they're on the phone and they're on the computer, so you hear me doubly, which cannot be fun. If you wouldn't mind, if you're a participant, making sure that on your computer you have muted your computer, so that way you don't hear it on both ways. Great. In any respect, we are here to serve the states, and in that we are hoping that all students exit school, college, and career ready. And in many cases, as you can see on the slide here, we're here to help struggling learners to ensure that all students do indeed exit college and career ready. And then most importantly, to work with teachers and leaders to help them and support them in serving the students that they are engaged with, as well as looking at the structural aspects in terms of looking at the systems across the board and ensuring that there's some sort of level of infrastructure there to support both the students and the teachers and the administrators in those buildings. Go ahead and go to the next slide, Whitney. And I'm going to pause here for a minute just because I keep hearing myself doubly. Whitney, is there a way we can mute that?
Not that I know of.
All right, I'll just call everyone's attention who's on the phone. If you could just mute the computer and or mute your phone so we don't hear it double. And I'm wondering, since everyone's muted, Kristen and Whitney and Lori, just make sure you have your computers muted as well.
I'm speaking through the computer, Lynn.
Okay, so you should be good. All righty. I've got my computer muted. Okay, hopefully this isn't too bad. One of the things that we wanted to do today is really think about alignment and coherence. Many of you are engaged with as a regional center staff, engaged with your states and helping your states deal with their priorities. Some of their priorities are indicated in the state equity plans, and others are also indicated in the state systemic improvement plans, which we'll talk about in a few minutes. But really, all of these have to work in concert in order for us to really impact the way that teachers and leaders are prepared and supported, as well as ensuring that we get to the level of improved outcomes. And what you see on the left-hand side here is just a little graphic to demonstrate how can we all work together so that states don't feel overwhelmed with all the quote-unquote support that we're bringing in. I hear from states all the time that they have a lot of people who want to come in and help, but in some cases it makes it harder for them because it feels very segregated or siloed in the way that we're coming in. So one of the goals, as we mentioned before, is to increase our awareness of each other's efforts and figure out how we can best coordinate our efforts to ensure that there's some level of coherence and alignment in our work when we go to support states to create this kind of system. right to the next slide. So with that, I'm going to go ahead and turn it over to Kristen, one of the co-directors for the National Center for Systemic Improvement, who's going to give you a little bit of an overview about the state systemic improvement plans and what those are and what those mean in terms of the work for the center, as well as a connection that you may be able to make in your state as well when you're working on the equity plans and other work that you're doing and engaged in. Kristen?
Thank you, Lynn. Hi, good afternoon, everyone, and thanks for joining us on this call. We are going to talk more in depth about the National Center for Systemic Improvement's work, and Rory will do that in just a minute. But before we get into that, we wanted to be sure we were all on the same page with our understanding of the State Systemic Improvement Plan, which is a major focus of the work of the National Center for Systemic Improvement. The State Systemic Improvement Plan is a new requirement for state departments of education, specifically the special education divisions within those state departments of ed. It's a requirement that's coming from the U.S. Office of Special Education Programs, or OSEP, and it is the requirement for states to develop a comprehensive multi-year plan for improving results for children with disabilities. As you may know, in special education for many, many years, we've been very heavily focused on complying with the procedural requirements of the IDEA, the Individuals with Disabilities Education Act. And within the last several years, OSEP has really worked with TA providers in states and localities within states to try to help us strike a better balance between focusing on compliance with the statute, which of course is important, as well as focusing on the results we're getting from the services that are being delivered to children and families. So as a result of that emphasis on results, we have the State Systemic Improvement Plan requirement, and states are in the process of developing those plans now. The State Systemic Improvement Plan will be part of what isn't a new requirement, and that is the annual state performance plan and annual performance report that states have had to submit for the last 6 or so years. The ESIP will be a part of that. Next slide, please. The State Systemic Improvement Plan has been introduced in phases. The first phase, phase 1, was submitted in April of 2015, and that was a year in preparation where states were focusing on analyzing their data, data about children with disabilities, but also data for all students in their state, and really looking broadly at the kind of information that was being collected about how children were doing in their states, and analysis of their state infrastructures, and really looking at how the divisions of special education interacted and interfaced with other divisions within their departments of ed and other state initiatives. They needed to, based on that analysis of both data and infrastructure, identify a state-identified measurable result or target that they were going to shoot for in a student outcome area. So some examples of what we're talking about there are a state might decide to focus on improving graduation rates for children with disabilities, or improving proficiency rates on the state assessment in reading or language arts or math. So it's a state-identified measurable result that needs to reflect a student outcome. And states also needed in their phase 1 plans to develop a theory of action that linked what they learned from their data analysis and infrastructure analysis with what they decided to try to do by way of improvement strategies to the ultimate outcome that they were looking for children with disabilities. So that was phase 1. Now we're in phase 2, which is the actual development of the plan. And those plans need to be submitted. The slide says February, but actually OSEP gave states a slight extension, and they don't have to be submitted until April 1 of 2016. But this is the getting down to the nitty-gritty of how that plan is going to look. What are states going to do to improve infrastructure? How are they going to provide support for early intervention and programs and LEAs at the local level to implement evidence-based practices? And a piece of this phase 2 plan must be an evaluation plan that will specify how states are going to know if they're accomplishing what they want to do as part of their ESIP. And then the final years of the plan, beginning in 2017, will be reporting on the implementation of the plan, and reporting the evaluation information that's being collected. Next slide, please. So just another word or two about the state identified measurable result. It is, there we go, that's the slide we should be on right now. The SIMR, which is the nickname people have given for the state identified measurable result, is a statement of the results the state intends to achieve through the implementation of their plan. The SIP also will include a description of the improvement strategies the state will use that will lead to the result that they've indicated. And they need to talk about how data analysis led to the identification of that area and how addressing that area will help to build LEA capacity to improve results for children with disabilities in their designated area of focus. Next slide, please.
Kristen, before you jump into the next piece, if I could interrupt just for a second. We have a polling about this, and I also wanted to open up the phone lines a little bit. It's just because the chatter in the chat box doesn't seem to be working so well, so give an opportunity for questions. But Whitney, if you could start the next poll. All right, same thing. If you wouldn't mind, just as a participant, going ahead and selecting, and this one is the select one, so go ahead and select and submit. And as you're doing that, as you well heard from Kristen, the State Systemic Improvement Plan is really the basis of the work that is undergoing in many of the offices of special education within both the state and really consequently the district level. Very similarly to the equity plans that also are part of what you guys are much more familiar with. So I just wanted to bring that up because the design of the state systemic improvement plans and the equity plans are very similar in that it's expected that you do a root cause analysis, that you really have a good understanding of what the data is saying, that you try to leverage and align with other state initiatives, and that of course you create a target or identify some priorities in your work to move the agenda in a particular manner. So it's very similar to what the equity plans are, or the process that the equity plans have gone through, or states have gone through to develop their equity plan. But I'm going to stop here and let people who are on the call chime in. In order to do that, you will need to just, on your top hand part of your screen, there is a microphone that allows you to unmute yourself. So if you wanted to do that, this is an opportunity to kind of just open up a little bit of dialogue before we jump into what NCSI is all about. Feel free if you have any questions. Otherwise, we can go ahead and go on, and you might have a lot more questions after you hear what NCSI is about. And Whitney, as we're doing that, can you put up the polling results? Wonderful. So it looks like people are familiar with our state plans. That's great. So then let's go ahead and then jump in. Kristen, I'm going to turn it back over to you so you can talk about how NCSI is prepared to support those.
I think we're going to switch to Rory at this point to talk about NCSI.
Sounds great. Hi, everybody. Good morning. It's like me, you are on the West Coast, and good afternoon to those of you who are not. We really appreciate everyone taking some time to learn more about what NCSI is, learn a few things about some of our specific initiatives, and most importantly, talk about ways that we can support each other's work. So, Whitney, if you'll flip to the next slide, that'd be helpful. At the very highest level, you'll see that really, now I can hear the double thing, I see what you mean, Lynn. At the very highest level, our charge is to provide states with technical assistance so that they can in turn support local programs. The comprehensive centers are of course specifically interested in school age populations. For NCSI, because we're talking about support for kids with disabilities under the Individuals with Disabilities Education Act, we pay attention to kids in early intervention programs with infants and toddlers, as well as kids in school-age programs starting with preschool and concluding when a student exits the high school platform into a hopefully successful post-secondary education and or career opportunity. If you look at the charge, though, and you stop just short of to improve outcomes, I wonder if you'll see a lot of similarity between what we're charged to do and what you're charged to do. My guess is that you all are really concentrating on building capacity so that you can improve outcomes in your states. And again, our charge is specific to kiddos with disabilities, but I know from my previous work as a state chief and deputy and federal programs director that really the comprehensive centers and the content centers are critical resources for states in building capacity across a number of areas. Another place that NCSI has a major role is to help states achieve what's called a vision of results-driven accountability. So as many of you will know, historically there has been a strong focus on compliance and monitoring for making sure that all the checks are in the right boxes at the right time from the right people with regard to special education. But we know that the theory of action that compliance drives results is one that hasn't borne fruit. So states are really working hard to pay attention not only to compliance and general supervision responsibilities, but also to shift that balance to be much more intentional about looking at the outcomes of kids with disabilities. What's the point of having something written down on paper at the right time in the right way if it doesn't actually generate a result for a student with a disability that lends itself to them being productive members and happy citizens in our society? So that's really the charge of what we're about. If you'll, Whitney, move us forward to the next slide, you'll see that we have a number of partners in this work. I just want to point out in this one particularly that WestEd and AIR, who are the two individual organizations that are represented across myself and Kristen and Lynn today, you'll know that we have strong connections to a number of the comprehensive centers and the content centers, and we take very seriously this connection to really trying to harness the skills and talents of folks across the board so that states are not overwhelmed by competing or conflicting technical assistance, but instead are receiving integrated and supportive technical assistance. So let's move to the next slide. Actually, we're going to skip over the next two, which are the objectives for the center. If you want to go back and look at those after the presentation, they're available in detail. They're the 7 objectives that we're required to. So Whitney, if you'll then move along to the slide that says guiding principles. Click, click, click. And stop there. Thank you. So you'll see that we have 3 guiding principles that are the foundation for all of our work. And in particular, I want to call out attention to this 3rd bullet on this slide, having to do with leveraging resources to maximize value and avoid duplication. Really relative to the CCs, we want to be very thoughtful and work in partnership with you all about how we can do those things that I mentioned a moment ago, how we can make sure that technical assistance is coordinated, is integrated, and adds value to the states without being conflicting or competing. So that's really the one thing I want to call out your attention to for this particular audience. Whitney, if you'll move us to the next slide on capacity challenges in the field, I would invite everybody just to take a look at this slide. You'll see that we're organized around the framework of trying to build capacity in 4 different areas: data use, knowledge utilization, systems change, and communication and collaboration. And I want you to take a couple minutes to just look at the content in here and see the degree to which those things that we've identified as primary capacity issues in the field generate or resonate with you all in your work. So after you read this for a minute or so, then I'd welcome a little bit of dialogue about the degree to which there's coherence across your work and ours around these capacity challenges. So as you look at those areas and unpack them a little bit in the blue content on the screen, how do those resonate with you and the things that you know your states are worried about? That you'll see that there's not anything on here that's even specific in this high-level example to kids with disabilities. So if you think about the work that you're doing, are these the places that your states are worried? I don't know if there's something that has to happen with regard to muting or unmuting the phone, but I would welcome some dialogue, and I can't see the chat box. So if folks are chatting, I'll need help from Whitney or someone to know what's getting said. So Whitney and Lynn, I don't know if states need or centers need guidance about muting or unmuting or chatting, but I really would love some reactions as to how these resonate with you all.
Yeah, I'm just I love trying a new platform. This is Lynn. It's always fun, and I hear my echo. I know there's a few people on the phone that are colleagues and friends of mine, and I'm just going to ask if they can test this out for us and unmute and just let us know if that's working. Dale, I see that you're on there. If you wouldn't mind unmuting and giving us the heads up that, yes, you can unmute and give us some questions. Or maybe Ira, would you be willing to unmute so we can hear if you guys can get to us?
Okay, so it sounds like we've got some technical things that need to be worked out in this new platform. What I guess I just ask you to do is keep those in the back of your minds as the things that we're particularly interested in. And again, sorry that we don't have an opportunity for a little bit of interaction, but I'm guessing, speculating, hoping that those are the same kinds of issues at the large level that you're really talking about with your states and areas in which they're concerned, both including relative to students with disabilities and beyond. So Whitney, let's go ahead and move to the next slide, please.
Corey, as you are moving, I did see that Dale indicated that he was not able to unmute, so we'll work on that. But there was a comment in the chat box that I wanted to share with you from one of our colleagues at the South Central Regional Comprehensive Center, was that the data use component is particularly similar to what they saw in the equity plan. So again, back to that very similar kind of design and how the equity plans also go.
That's great. Thank you for that feedback, and it's affirming to know that, reassuring to have the affirmation that we're all really systemically thinking in similar kinds of directions, and that there's the possibility that we can align our resources and efforts to try to be systemic in helping states in those endeavors. So if you look here, you'll see that we approach this from a differentiated approach to technical assistance. We have 3 levels: universal, targeted, and intensive. Universal technical assistance we're really trying to make active and ongoing, and sort of our joke inside is that universal technical assistance is more than here's our website. We know sometimes that's been a complaint of state clients from the various ways that, or they've worried that when new centers are funded, that universal supports is only something that's going to be, sort of here's where a website goes. And that's probably different than the comprehensive centers who have such active relationships with each state. It's probably more something that some of the content centers have heard concerns about in the competitions that go on. So making sure that we're all being really intentional and thoughtful about that is a priority. I want to spend just a couple of minutes talking about the learning collaboratives, which are our main form of technical assistance, and then also just let you know that we do engage in individualized custom technical assistance at the targeted and intensive levels, and those are places where there might be opportunities if you've got relationships with your states and written into the work plans efforts about increasing outcomes for kids with disabilities. Those are places that NCSI and your comprehensive centers may be able to collaborate. So let's go ahead and switch to the next slide, please. And you'll see, I just want to call your attention to the words in green here. A learning collaborative is similar to a model of a community of practice. Some of you may have been engaged in prior communities of practice. Learning collaboratives are networks of shared leadership and peer support. It's coming together both face-to-face and through virtual engagements to understand what the issues are, to talk about solutions to those issues, and then to support one another in the implementation of those issues. And of course, across all of this, it's building capacity in those 4 foundational areas. So if we could switch to actually 2 slides ahead, Whitney, the one that says Learning Collaborative Focus Areas. you'll see that we've gathered together learning collaboratives targeted around key content. And I'll just give you a little overview of what those are. There's a couple of sections on language and literacy. There's one on mathematics, one on social emotional outcomes, which is more targeted at infant and toddler and preschool age children, graduation and post-school outcomes, results-based accountability systems, which is trying to think about how to expand our analysis of assessment and accountability systems to include performance data for kids with disabilities, not merely looking at compliance data, as we talked about earlier. School Turnaround, which is an intentional collaboration with the Center on School Turnaround to try to focus in on the performance of kids with disabilities in our lowest achieving schools, including the priority focus and, depending upon state accountability systems, other identified schools for low performance. And then Family Outcomes, which is really specific to infants and toddlers. So if you look at these areas of collaborative focus, let's go back then one slide, Whitney, please, to possible CC engagement with the learning collaborative. This is the part where we hope it will begin to feel a little real for you all in terms of ways that there might be opportunities for us to intentionally and meaningfully collaborate with one another in this endeavor. So that could include you all engaging in the learning collaboratives within your state CC work plans. So if you've got within your work plans issues relative to, for example, increasing reading results for kids with disabilities, that's a possibility that that state has signed up for the learning collaborative on language and literacy. One thing would be for you to possibly attend with states as part of their team, to participate in the functions where your states are actively engaged, to be a part of that ongoing work. That could include, during the face-to-face functions, helping to facilitate state team discussions and or providing content that is relative to that particular subject area. It's also possible that you can provide content and engage in the virtual elements, and we can unpack these a lot more deeply. If you have an interest in doing so, we can follow up specifically with you to figure out ways that this makes sense. It's also true the number of you have probably developed tools or resources relative to some of these content areas, and this might be a platform to harness the resources that already exist. So I would welcome some input or some questions about the degree to which there's interest in engaging in any of these. Because it sounds like the mute situation doesn't want to unmute, I suppose I'll invite you to just enter information, either questions or ideas or reactions, into the chat box. And because I can't see those, then I'll need somebody like Whitney or Lynn to help me know if there's any chatter in the chat box. Lynn, anybody typing?
Thank you all, and thanks, Rory. Right now, Whitney is going ahead and unmuting everyone. It seemed like that folks tried to unmute earlier and it wouldn't work. So let's see if that works. Otherwise, I will continue to read to you some of the comments I'm seeing in the box. So I'll stop for just a moment and let people chat.
Hi, this is Carrie at the South Central Comprehensive Center. Can you hear me?
Carrie, this is Debbie in the Southeast Comprehensive Center. I heard you.
Thanks, Debbie.
Yes, we can hear you. Go ahead.
Oh, great. So I just wrote in the chat box that one of the things that we did before NCSI was up and running was worked with a consultant to help support our states with the development of their SF, and that work is ongoing. So now we want to make sure that we are not being duplicative and that we're not giving different messages. What is the best way from your perspective that we can align that work so that our consultant and the support that your staff members are giving is consistent?
Well, Carrie, that is such a great question. Thank you for doing that work for your state and for pointing that out to us. So I would say that for every state, every state, NCSI has identified a TA facilitator, and that's similar to the state liaison model that I know a number of comprehensive centers use. It feels to me like the most effective first step would be to put the state or the TA facilitator for NCSI and the state liaison for the state, if that's the model you use, together on a call, maybe with the consultant, so that we can be working to figure out sort of what's happening in align efforts. What do you think about that?
That sounds like it would be a really good approach. Where do we get?
Cool.
How do we find out who the person is?
Yeah, Carrie, as soon as we're finished with this webinar, we will send you the listing of all the participants here, the listing of TA facilitators, so you will have their email addresses and know what states that they work in.
Thank you.
This is Sarah Hall, also with South Central, and Carrie and I have worked together and looking at our year 4 plans and trying to determine when it would be wise to do some of this work regionally. So having the list of facilitators would be great. Thank you.
Thank you. Other questions or ideas around ways that you might want to try to connect with the Learning Collaborative work? Anything in the chat box, Lynn, that we should attend to?
Not yet. Deborah Melbon down in the Georgia has indicated that information sharing, and I don't know if you want to expand upon that, Deborah, but obviously for states to just really understand these efforts that are going on. I think one of the things that Rory, you mentioned, and I just want to call attention to again, is just this being part of the state teams and making sure that we're pulling in the right parties together. Sometimes the equity work and the systemic improvement work seem separate in states, where in fact there's a lot of ways that they can leverage one another or leverage each other's efforts. And for these learning collaboratives, I see them as very, very similar to a lot of the regional and national meetings that we've had through either the GTL Center or through the Comprehensive Center Network. And, it'd be great if we could have regional center representation at some of these collaboratives as just another way to make those connections. And I'll stop there to see if, Deborah, you have something more to chime in there.
Thanks, Lynn. And I'm in Mississippi, not Georgia, but you were close.
Oh, sorry about that. I'm close, Southern.
I just think the more that we know about what the other centers are doing, the more informed work we can be providing. Just seeing what you were talking about earlier about some of the work with the data analysis and then pointing out the similarity between that and the equitable access plan, I think is really critical. And then just also seeing there is such a similarity between the type of work that we're doing with capacity building that the NCSI Center is doing. So I think we need to learn more about each other, and when we do that, we'll be able to participate more fully in these learning collaboratives.
That sounds great. And Whitney, if you would switch to the next slide, which is going to be my last slide. Oh, go ahead. Somebody saying something? Maybe that's a side conversation. So switch ahead one more, sorry, Whitney, to the slide that talks about Part B, state identified measurable results. So this slide deck, and you might want to mute your phone if you're having a side conversation. So this slide deck, I believe, Lynn, will be made available, and we could even send that out. I'm not sure because it's kind of internal. I don't know how we're going to deal with that, Lynn, but I'm sure that you'll be pushing it out or putting it up and letting people know about it. But anyway, relative to those state-identified measurable results about which Kristen spoke earlier, sort of where states are putting the stake in the sand with regard to performance of students with disabilities, you can see here across the country, this is the kind of very highest level analysis of what states are concentrating on. So if you want to just have this as a reference document after the fact to look within your region and see, all right, where are my states really focusing on outcomes for kids with disabilities? This is information that some of you may already have and others of you may not. just seems relevant as a resource tool. And the other thing that we will do is provide you with an internal, not to be distributed copy of the analysis of which learning collaboratives which states have signed up for. States issued to us letters of intent in late July saying, here's where we think we're going to be an active part of this work. And then they are right now submitting letters of commitment. So what I will send to you, or what we will provide to you kind of in a packet with the TA facilitator assignment, we will provide you with a breakdown that says state by state, here's who has signed up for what. And that will be an opportunity for you to know what your states are focusing on in terms of learning collaborative engagement. I'll ask you not to disseminate those beyond internal staff use at this point, because the data we share with you will come from the letters of intent, and politics being what they are, they're working their way through the systems of signatures and whatnot for letters of commitment. But I do think that it's useful data for you all to have behind the scenes to know where your states are interested in focusing their efforts, and for you guys to think about the degree to which there is overlap and coordination possibility in your work plans, if that makes sense to everyone. Okay, with that, I will turn it to Kristen to talk about any additional connections to NCSI and close us up. So thank you very much. Kristen? Is Kristen now on mute?
Well, I am absolutely loving technology today. It's my best friend. As we're waiting on Kristen to come back, I did want to just make note that on there's a couple of things that people have noted, Rory, I wanted to call your attention to. And then also in regards to everybody who's on the phone, we are also joined, not only do we have regional comprehensive center staff that are here, as I mentioned before, a lot of our NCSI facilitators are also online, because everyone is really wanting to try to connect and make engagement. So a couple of things I just wanted to point out before people start to get off. One, we will send out the PowerPoint as well as a recording of this webinar to everyone so that you can share it with your regional center colleagues. We will also send out to you the listing of the NCSI facilitators as a way to connect. And I know myself, as well as Rory and Kristen, open up any opportunity that you guys can think of in terms of trying to connect our work, because the last thing we want is for states to start to close their doors to federal TA providers, because there's way too many of us coming at them in so many different directions. But I did want to, Lori, there's a few people that mentioned that the learning collaborative participation would be very helpful, that the regional centers would interested in that. So if we could share that information under the auspices of not, spreading it across the world, but enough that it introduces the regional center to have that conversation about an interest in someone helping supporting their work, I think that would be great.
Great. We're finishing that snapshot now, and we'll absolutely provide that to you right away. So it sounds like, Kristen, are you able to get back on yet, locally?
Can you hear me?
Now I can, yes.
Oh, good. I'm so sorry. I was, I don't know what happened. I was on the phone, then I was on the speakers, and now I'm back on the speakers. So if we could see the next slide, that would be great. Great. Hi. Thank you, everyone, for bearing with me while I got back on the phone. We wanted to end the call by talking about ways to make connections between the comprehensive centers and the National Center for Systemic Improvement. Rory's already mentioned that we are organized by having individual TA facilitators or state liaisons assigned to every state, and that's a great way of making connections between the comprehensive center state liaison assigned to a state and our TA facilitators. So as Rory said, we're going to send out that list of assignments so that with their emails, and you'll be able to be in touch. And we'd appreciate it, actually, Lynn, I don't know, maybe you can help us get this information. We'd also like to have a list of the comprehensive center state liaisons as assigned to every state. So it would be great if we could share that information across the comp centers and NCSI. In addition to that, Rory's already talked about connections through the cross-state learning collaboratives. And then beyond that, I think we can stay in touch. You can contact either Lori or myself with questions. One way that we might collaborate is thinking about national or regional events that are upcoming, and are there ways for us to present at each other's events or communicate or join a state team that might be coming to an event. Another idea that we could think about is whether or not we might want to have regular or quarterly calls between Comprehensive Center directors and NCSI. There are also opportunities that we tend to participate in together or jointly that might be coming up in the future. We just finished a conference in DC that was a joint federal programs meeting, and I'm thinking probably a number of Comprehensive Center staff were there. We also had a number of NCSI staff and other OSEP-funded TA centers. And the Leveraging Resources Conference, which has been happening in the spring of the year for the last many years, is another great way for us to make connections. And those are my ideas, but I'd be interested if there are others on the phone who have other ideas about how we might work together, either individually within a state, regionally, or some kind of national event or other way for collaborating. Lynn, do you think it would be possible for us at NCSI to obtain lists of Comprehensive Center state liaisons? And if so,
Yeah.
what do you think would be the best way for us to go about requesting that information?
You know, I'm wondering, as a follow-up to this, what we can do is, once we have this recorded, send this out to all the regional centers, not just those that are participants today, and, you know, include the listing of state facilitators, and in turn ask for each of the regional centers to send us their listing of their state liaisons. I have a listing that we use, obviously, for the GPL Center, but it changes, so it would be nice to get that get it straight from the folks that are working there. So that would be one way that we could do that. That way we can, share that information across both parties.
Okay,
that sounds like unless other people, unless other regional center directors or participants have other ideas, but that's just something that comes to my mind that might work.
That sounds like a great idea. Okay. Let's see what our last, I think that we're getting to our last couple of slides. Let's see what our next slide, can we have our next slide, please? So, talking more about how we can work together, what we are really interested in is wanting to present a coordinated, integrated approach to our work with states, and we touched on that a few minutes ago, how important it is for states not to be overburdened or confused between the different TA centers that are asking to work with them. So we want to be unified and coordinated. We also want to maximize and leverage the resources that are available through other TA centers, including the comprehensive centers. And we really think that we have a lot in common with the regional comp centers in terms of shared objectives for working with states to improve their capacity to improve results for all children. And of course, great teachers and leaders are a part of improving results for kids. So there's a clear connection there, I think, between the SIP that states are working on in special education and the equity plans that you're working on with states, and a lot of other state initiatives that are focused on improving capacity at the local level as well as results for students.
Yeah, and I'm just going to check in, Kristen. You guys, many of you know me. I work in the Center on Great Teachers and Leaders, but also have a background in special ed, so I get the opportunity to work with Kristen and Rory and all the colleagues at NCSI, and then I also work on the Cedar Center. And, as I look at the world in terms of special ed, general ed, teacher effectiveness, equity, all of those good things, I see a lot of great efforts happening, but very siloed in the approach. And most particularly, there's so much that can be learned and gleaned in terms of what happens in the world of students with disabilities that can really help all kids achieve better outcomes. But yet there still seems to be somewhat of a divide between the approaches in terms of special ed versus educator effectiveness versus curriculum and design and all of those things. And I shouldn't even say versus, because it's not a versus that we're against one another. It's just that we need to do and try to figure out how to leverage each other's expertise and knowledge to kind of move this agenda along. So perhaps I have an ulterior motive too in trying to make these connections across the board, because I do think that there's so much good work happening and there's so much work that needs to be done that we just really can't expect or afford, segregated or efforts that kind of aren't aligned. And so, if I can help in any way, many of you know me through the GTL Center, but I do have the connection to the NCSI. So, if you need any help in any way or want help in figuring out how do we make better connections across the board, just reach out. We'll be happy to problem solve and think that through.
Thank you, Lynn. I think we are about out of time and out of slides. I think we might have one more slide with Rory's and my contact information on it.
Yep.
And there it is.
Great. Well, thank you all for participating, and again, apologies for the little bit of technical difficulties, but we will definitely send that out, and send us an email, all of us, if you have ideas or ways or things that you want to connect. In the meantime, what we will do is send you the PowerPoint as well as the listing, with also that request to kind of in turn send us the listing, so that way we can share it with our NCSI facilitators as well, and we can start creating these bridges. And Rory, Kristen, anything else to add?
Just thanks for giving us the opportunity.
Yep, this is Rory. I would just say ditto to that, and I really do hope that we can be intentional in connecting some of these efforts. So I appreciate the questions and the interest in doing so. Thanks, everybody.
Thank you very much.
Bye.
Thank you all.